Welcome back to the Morning Blend. Well, women with breast cancer used to have limited choices when it came to surgery, but now medical advances are changing that. And Dr. Julie Kepple is a board-certified, fellowship-trained breast surgeon with Aurora Healthcare, and she's here to talk about new techniques that successfully remove cancer and maximize the cosmetic outcome. And I think this is such good news for women who have breast cancer. And we were just talking during the commercial break, how many women get breast cancer? It's about 1 in every 8 women will have breast cancer during their lifetime. So it's a lot of us.
And I found some of the things here that you're going to talk about just really revolutionary. I did not realize.
And I didn't realize that you could have surgery to treat the cancer and also do some things cosmetically.
Right. So, you know, when people think about breast cancer treatments, our patients usually have options of a lumpectomy, that's removing the tumor with a normal rim of breast tissue around it, so you're ensuring that the cancer is all out. Or their other option is a mastectomy. And things have kind of changed because instead of just, you know, making an incision right over the tumor, and depending where your tumor is, you know, some of our incisions might be visible if it's in the mid part of the breast. So now, as a breast surgeon, you know, we look at the size of the breast, the size of the tumor, and then we're already thinking kind of 3D. How can I get this tumor out? And maybe leave the woman with an enhancement in her breasts, but more importantly that, again, the tumor's out and that their risk of recurrence is low.
I think when you say here oncoplastic lumpectomy, am I saying that correctly?
Correct.
Surgically remove the tumor in its entirety while reshaping or remodeling the breast, often results in a breast reduction or a breast lift. Matching procedure to the other breast, most beneficial for larger-breasted women.
Right.
That's just, I think, revolutionary in that you're going into this sort of horrific thing, but there is this kind of positive outcome, right? Am I right?
Or I tell to the patients, it's a little bit of a silver lining in a bad thing, and it's a way to kind of focus their mind also to something more positive. So it's very rewarding as a surgeon to see a patient who's very scared, wants to make a decision, but to reassure them that yes, I could remove this tumor and you could still look very nice. It's a great thing. You know?
Yeah, and you think about going through cancer and the treatments that often accompany it, and then to think that you can end up not being disfigured and to look good. I mean, I feel like what you're saying is some women end up thinking their breasts look better after cancer surgery and the cosmetic procedure than before, which I think is fantastic. Do some people worry that you're not getting rid of the cancer as thoroughly if you leave more breast tissue or you do something cosmetic?
Well, the advantage of some of these techniques, when you're looking at the patient and where their tumor is, and when you're hiding certain incisions, sometimes you're actually able to get a bigger margin around the tumor than if you just directly went after the tumor by making an incision over it. So again, that's kind of important to us as surgeons because we don't like, you know, having to take a patient back to get additional margins. So when working with a plastic surgeon, sometimes we're able to actually remove more tissue to ensure we're getting clean margins, and again to reshape, you know, give somebody a breast lift is good. My favorite surgery, oncoplastic-wise, is the nipple-sparing mastectomy. So we have some women who are at high risk of getting breast cancer, either because of their family or they might have a gene that's being passed through the family, and they really want to be proactive, but again, they're scared of having a mastectomy and what that will entail to their appearance or their self-esteem. And so we're able to now do procedures where through an incision on the bottom part of the breast where your bra would rest, we can remove the entire breast tissue, and then with the help of a plastic surgeon kind of restuff the breast. And so it's very nice. The patients come back and say, oh, I'm here for my breast check. And I'm like, well, gee, didn't I do a mastectomy on you? No, doctor, just examine my breasts. So that's a very important thing. You're overcoming such a big psychological barrier. So patients can have surgery, reduce their risk. They can have their cancer treated, and they still feel whole.
So you're talking about that in a prophylactic mastectomy?
It can be done in a setting to reduce someone's risk prophylactically, or sometimes depending where a breast cancer is in relationship to the nipple, we can even do it for breast cancer patients.
Let's talk about the psychological benefit of this, because I think it's important. You know, it's losing a part of your body, and knowing that you have cancer is difficult. Do you find with improving body image and restoring people to, you know, something that they're happy with and feel good about is a benefit in their overall wellness?
Obviously, the answer to that is yes, because, you know, feeling good about yourself, and also, you know, we're in a society where people do look at appearances, and so to feel whole and feel well, they kind of go hand in hand.
This is great news.
I think it's great news too. And I think for all of you listening, if you have a loved one who's recently been diagnosed with breast cancer and would like to get a second opinion on your treatment options, please call this toll-free number. It's 888-649-6892 to schedule an appointment, or check out the website. It's aurora.org/second opinion. So nice to have you on the show. Thanks for sharing. Appreciate
Thank you
it.
for having me.